Dental health is important in pets because when left untreated, dental disease can lead to a lot of discomfort, and it can even lead to disease in other parts of the body. Initially, you'll probably see some gingival redness, gingivitis. You're probably going to see some dental tartar. This can vary in color, but it can be caramel colored, brown, and sometimes I see orange, kind of candy corn looking dental tartar. You might see some bleeding, especially where your pet is chewing on toys. If your pet is an aggressive chewer, you'll start seeing some bleeding from the gingivitis and from that like mild infection at first. After that, halitosis or bad breath. That's probably one of the more common reasons why we get appointments related to dental issues in pets. And then when it's really bad and you have an untreated tooth root abscess, you'll see swelling underneath the eye, and more often than not, I'd say 9 times out of 10, it's a tooth root abscess that's left untreated. Honestly, chronic discomfort and pain for your pet. To me, that's the main thing. And again, I get a lot of pushback. Well, my dog's been eating fine and he's never had an issue. Just because they don't show weakness doesn't mean that they're not in pain. They have that drive to survive. And more often than not, those patients are still eating. That's not a good marker for whether or not your pet is in pain. Best way to clean teeth at home, brushing daily will make a big difference. Other than that, if you can't brush daily, brush every other day. There's a lot of products out there. Like, you'll get overwhelmed if you start looking online. I always narrow it down to, is it approved by the VOHC, which is a Veterinary Oral Health Council. It's a little square, white square that you'll see on products. That means that they have a stamp of approval from veterinary dentists and specialists. So experiment with those, whatever your pet likes. Out of those that are approved, probably a good option for your pet. In veterinary medicine, or at least here in Las Vegas, veterinary technicians are required to be licensed. So we have a licensed technician that will take care of placing the IV catheter. After the IV catheter, we induce anesthesia, propofol usually, which is a liquid anesthetic. Then we proceed to intubate. Once the patient's intubated, we hook them up to all monitoring equipment. Once all the monitoring equipment is necessary to make this procedure as safe as possible for our patients, then we proceed to charting. So we probe around for any defects. We write them down on our dental charts. Scaling and polishing, we use an ultrasonic scaler. We get all the tartar off of the teeth, and then we do full mouth x-rays, same as we get done when we show that uncomfortable piece of plastic and they melt the little probe around to take x-rays. We do full mouth x-rays. Highly recommend it on every patient. There's a lot of stuff under the gumline that you're not going to find disease-wise unless you do dental x-rays. Once that procedure is all done, veterinarian comes in, we probe around, we look at the chart, we compare and evaluate all the radiographs. We don't find any issues. Then we proceed to lower the anesthesia levels and take patient off of anesthesia, take the tube out and recover. If there are issues, at that point you'll receive a call up from your veterinarian with recommendations as to what might need to be done. And we can discuss extractions at the later video. If you're at all worried about your pet's dental health, please reach out to your local veterinarian.